Horn. Developing tonight, Life EMS and other health agencies are stepping up to cover patients who are in need of life-saving transportation.
Yeah, the emergency medical service was forced to come up with a plan after West Michigan Air Care announced they'll be ending all helicopter patient transport in April due to a decline in flights.
News Channel 3's Autumn Pitcher joins us live from Life EMS. And Autumn, you spoke to the president, who says they're optimistic they can cover those necessary routes.
Yes, Andy, Jessica, West Michigan Air Care takes 350 calls on an annual basis. Now, Life EMS President Mark Meyer says this is something that they will be able to handle. However, I spoke to several Kalamazoo residents today who feel that air transport is essential to saving lives. After celebrating their 11th anniversary last May, a shooting pain woke Ellen Collier's husband, John, up in the middle of the night.
My husband felt like he was being stabbed in the chest.
Paramedics taking John to Bronson Battle Creek ER, finding he was bleeding out in his chest and around his heart.
Bronson system did not have a surgeon to be able to do the necessary repair.
West Michigan Air Care flying him to the University of Michigan Hospital.
Literally just in time, the surgeon there told us that they had him open within 7 minutes of landing, and if it had been any longer, they're not sure that they would have been able to save him. Why eliminate a service that could save people's lives?
Operation for Bronson Healthcare and Ascension Borges' Air Care coming to a halt April 20th. Life EMS stepping up to cover transportation.
We're confident that our folks here at Life EMS, we have lots of critical care paramedic trained folks, and that we'll do our best to make sure there's no gaps in serving the patients.
President Mark Meyer optimistic their teams will be able to take on the magnitude of West Michigan Air Care's 350 annual calls.
With Air Care's volume being ballpark one transport a day, that's probably something that we can assimilate into our current deployment.
Life EMS covers a 5,000-mile radius from Kalamazoo as far north as Mason.
All of our medics and EMTs at Life EMS, we're very used to going outside of Kalamazoo County all of the time.
Myers says responders will have to make more trips to rural hospitals.
We do have people out in those areas, and we have critical care equipment, for example, in Allegan and places like that.
With ventilators and cardiac monitors, Logan Connell, a paramedic, says Life EMS trucks are fully equipped.
We have our blood pressure monitoring right here. And we can do all kinds of different blood pressures with this. We can also measure oxygen saturations for people who are on a ventilator or maybe just needing a little bit of extra oxygen as well.
Collier believes the resources aren't enough.
To rely only on ground transportation when we already know that they're short-staffed, that we're already having delayed response time, I'm not sure that that's the best solution.
Life EMS has 700 employees across the locations that they serve. Now, Myers says they are working with West Michigan Air Care to be able to create more employment opportunities at Life EMS, which he says will help with their staffing, especially while they cover additional life-saving transportation during this time. In Kalamazoo, Autumn Pitcher, News Channel 3.